Today we are going to talk about the healthcare system in Colombia and United Kingdom. In Colombia, Law 100 established a healthcare system that consists of two parallel plans: a contributory health plan for those citizens who are able to pay, and a subsidized health plan for those who are unable to pay. In order to determine the socioeconomic stratum of each person or family, a survey called CISBEN was carried out that divides the population into 6 strata, 1 being the poorest and 6 the richest. According to the survey result, people will be placed in one of the plans. Those placed in the contributory plan, strata 3 to 6, must contribute monthly a certain amount from their salaries to finance the system, while the state covers the cost corresponding to those within the subsidized plan, strata 1 and 2. Upon classifications, families that fall under strata 1 or 2 should become affiliated to subsidized plan administrator, ARS, Administradora de Régimen Subsidiado, which provides them with a card that entitles them to have access to the health system. Although it was initially predicted that by the year 2001 that the entire population will be included in the healthcare system under one of the plans, the truth is that currently there are 20 million people who don't have access because they haven't been surveyed or affiliated by an ARS. The problem is that affiliations and card distributions depend on the availability, place, and not on the demand. Each plan has a separate compulsory health plan, which is called POS, Plan Obligatorio de Salud, with different coverage for each plan, while the contributory plan covers nearly all illness and health problems. The subsidized plan leaves out a significant amount of illness and doesn't take into account regional difference. Those affiliated to a contributory plan pay their corresponding payment to a healthcare promoting office, EPS, Entidad Prestadora de Salud, which acts as an intermediary. The EPS deposits the money into a FOSIGA, Solidarity and Guarantee Fund account within the Ministry of Health after deducting a part for maternity leaves, accidents, and other contingencies. The FOSIGA returns to the EPS a certain amount for each affiliated person, which is called the UPS, per capita payment unit. In the case of the subsidized plan, the ARS becomes the intermediary party that receives funds from the above-mentioned FOSIGA account and from official institutions. The healthcare providing institutions, IPS, Instituciones Prestadoras de Salud, include hospitals, healthcare centers, etc. They work according to demand. Instead of having a set budget, the IPS and ARS pay them according to the invoices issued for each service rendered. Therefore, the IPS avoid providing healthcare to poor people who cannot guarantee payment, which therefore leaves the linked out of the system. Patients are turning to clients and healthcare centers lack budgets to buy medicines or pay for salaries, surgeries, etc. Furthermore, those affiliated to the contributory plan can go to any public or private IPS, whereas those affiliated to the subsidized plan can only go to all public hospitals.
The United Kingdom has a government-sponsored universal healthcare system called the National Health Service. The NHS consists of a series of publicly funded healthcare systems in the UK. It includes the National Health Services in England, NHS Scotland, NHS Wales, and Health and Social Care in Northern Ireland. Citizens are entitled to healthcare under this system, but have the option to buy private health insurance as well. The Commonwealth Fund report looked at 5 areas of performance: quality, efficiency, access to care, equity, and healthy lives. The Netherlands ranked first overall, closely followed by the UK and Australia. The health insurance system in UK is governed and guided by National Health Services, which aims to publicly fund the healthcare companies in all of the different parts of the UK.
Created using Powtoon.